Good afternoon, everyone. Thank you for joining us for this town hall. We're here with some updates and to answer questions that you may have. Before we get started, I want to acknowledge that we're living through a very challenging time. I would like to share my sympathy for anyone who has fallen ill or lost a relative or loved one to COVID. As I shared yesterday, the Lawndale community just lost one of our beloved teachers, Mr. Fred Garcia. Our hearts are with his sister Rosa and the rest of their family, as well as with his students who miss him very much. I want to thank the Green staff and teachers for their incredible support, and to Christine Kim and Jamie Valentine for their compassionate leadership. This is a webinar where you'll see myself and our assistant superintendents, Dr. Juan Santos, Mr. Travis Collier, and Dr. Gretchen Jansen. And each of us will share a brief report, and afterward, we're here to answer any questions you may have. Please enter your questions into the chat, and Dr. Santos will moderate the conversation. First, we are living in a very dynamic time, and what we share with you today may change tomorrow or even while we're sharing this. We had been preparing for the TK2 waiver process to bring back students at those grade levels, but Governor Newsom unexpectedly proposed a new plan which eliminated the TK2 application process and introduced a new process. Unfortunately, we are not eligible for this process until our county COVID case rate is less than 25 per 100,000 population. And the current case rate is declining, but is currently significantly above that threshold. It's about 38 cases per 100,000 at this time. And the governor's plan is really a proposal that is still being debated in the legislature. And I'd like to have Dr. Jansen share a few remarks.
Thank you. Good afternoon, everyone. So information about Lawndale's response to this pandemic is readily available on our district website, including our detailed Safe, Clean, and Ready plan, and the most current information we have regarding vaccines. A little bit more on vaccines. About 2 weeks ago, Dr. Hamilton sent out information to staff and parents related to vaccines. Currently, I think we're all pretty well aware that in LA County, vaccines are currently available for healthcare employees and those that are 65 and older. I'm sure that we all remain hopeful that the education sector, which would vaccinate our staff, will be next. Unfortunately, the state of California and the Department of Public Health have had some pretty significant vaccine supply challenges that are affecting the process. I want to reassure you that we're currently in communication with a local partner, the Beach Cities Health District, to help develop a vaccine distribution plan for our staff. There remains much to plan here, but we're hopeful that this partnership could benefit Lawndale's employees. And I think we all are aware that currently we have no information available about vaccinating children under the age of 16. Another important point is that our district really hopes to be able to offer paid time off for our employees to access vaccines. We know it's very difficult to get appointments, and we want to make sure that we accommodate employees so that all who want to be vaccinated can be. And then as a reminder, even after we are vaccinated, the Department of Public Health will still require that we continue to wear masks outside of our home and socially distance because we still need to maintain those precautions at this point in the pandemic. With that, I'll let Dr. Santos share a little more information.
Yes, again, welcome everybody. Regarding opening schools, our primary objective is as always to provide the very best educational program we can while ensuring the safety and the health of our students, our staff, and our families during this pandemic. Distance learning is the safest program we can offer during the pandemic. This is why on January 21st, Dr. Hamilton, our superintendent, proposed to the Board of Trustees that we remain in distance learning for all, but our very highest needs students, those who may not be benefiting from the distance learning program that we currently have in place. Just to reassure you, all of our schools were inspected by our Department of Public Health and were approved to reopen for students. We will continue to work with our labor partners, both LTA, Lawndale Teachers Association, and LFCE, the Lawndale Federation of Classified Employees, to ensure that opening or that rather our reopening is safe to all staff as well as the students. At this time, I'm going to have Mr. Collier discuss a little more about this special days class small cohorts.
Good afternoon, everyone. I just want to say well wishes to all of you and your families. Special days class small cohorts. Some of our staff, both LTA and LFCE, are not able to return to work, and they will continue to provide distance learning to their students. To support our SDC students, teachers, and families, the Special Education Department is developing assistive videos and learning tools to support families with managing challenging behaviors that make distance learning difficult for some students. We're doing our utmost to support these students and their families while we work to keep our staff and students healthy. Because we are equity-minded, we want to bring back those students with the greatest need for in-person instruction. We plan on bringing these small number of students in on Monday, March 8th. The plan is to bring teachers and staff back on March 1st for training and preparation. State preschool. Preschool students have been back since October 26th. They have been on full distance learning since the winter break due to just the recommendations from the LA County Department of Public Health to stay off campuses. But those students will return to in-person instruction on March 1st. I'm going to turn it back over to Superintendent Hamilton to give you some further information.
Thank you. As you know, the decision to stay in distance learning can help our teachers and our educational services department really focus on improving the distance learning program and refining virtual instruction. Our teachers and other staff have in a few short months, I'm sure it seems like years, but in a short amount of time have introduced innovative online learning, developed common instructional strategies, and established consistent communication platforms with our families. And our staff are to be commended for your resilience, your tenacity, and your creativity. And many of these new 21st century instructional strategies and platforms will continue to be utilized into the future, even when students return to in-person instruction. So we now will be turning our attention to planning for the summer and for the special education extended school year and other summer programming to support our students. And we'll continue to monitor the progress of the virus and of vaccines and testing in order to plan effectively for the fall. And I'll continue to send messages each Monday to staff and parents regarding our plans. And now I think we're ready to start answering some questions, and Dr. Santos will moderate the chat.
Okay, we have a couple of questions. The first question comes in, what will school look like in the fall?
I can answer that. I'll get off of mute here. For the fall, we are planning a hybrid. There are a number of factors that we have to look into in terms of what the LA County Department of Public Health guidelines will be. We have a hope to have a schedule ready for spring break, and that we will work with the instructional planning committee and teachers to develop schedules, and then we'll send out hopefully a parent choice survey after spring break to determine who would want to be on hybrid or distance learning. Hybrid just basically means a combination of distance learning and in-person instruction, but there's a lot of development and obviously guidelines and updates from LA County Department of Public Health that will guide our schedules are, and so we'll keep you updated as we know more.
Okay, our next question comes in, and the question is, why are SDC students and staff returning in general ed if general ed is not due to safety?
Well, it's an equity decision, which means it's based upon the high needs of the students. The students who parents have selected for them to return to campus have difficulty fully accessing and engaging during distance learning due to their disabilities. The students are returning in very small cohorts, the largest being I think, approximately 7 students. Safety and health protocols will be strictly enforced, and the staff has been and will be provided proper training and ongoing support.
Another question came in regarding travel. Do we still need to follow travel restrictions?
I can address that. It's recommended that the Department of Public Health, we have a meeting with Dr. Barbara Ferrer and Dr. Gilchek from the Department of Public Health every Thursday morning. And as of this morning, the message was that we ought to, as much as we can, only interact with people from our immediate household. Obviously, when we come to work, we may be interacting with others, including students and other staff, but as much as possible, and also to restrict our travel, certainly travel outside of the county or state.
Okay, we have a question coming in regarding our social and emotional curriculum. What social emotional curriculum are we going to provide to staff to help students during this pandemic?
Well, I mean, in terms of curriculum, so we have 4 professional developments that are provided around social emotional learning. The social workers and student support services provide those services. If there are things beyond that PD that teachers need, they can definitely consult with their social workers, and we can be in consultation with what else may be needed and required as we continue to work with students and staff.
And just to chime in on that as well, I believe there is a curriculum called Second Step, and I believe there's a few others or one other. But I think that question can be answered specifically by your social worker at your site. I know they're available to share that. Next question comes in regarding ESY. Is ESY in person this year?
Yes, ESY will follow the same format as those parents who select to have their kids come in, their students come in person will be afforded the opportunity to be on site, and there will be a choice to be in distance learning also.
Okay. There's a question regarding can the opening be pushed back until affected staff members have both doses and vaccine? What information do we have at this time regarding vaccinations?
Dr. Jansen, I can just what Dr.
I'd be happy to. I think that's so small cohorts of SDC students that bringing back students in that fashion has been available to school districts throughout California and even in LA County, dating back to, I believe, around October. Lawndale is one of the only districts that has yet to bring back small cohorts of students, and there's specific guidance around those groups. I certainly understand and appreciate the logic of the question related to vaccinations, but know that if and when students are available to come back, hopefully in early March, we will have all of the protocols in place. And Dr. Hamilton and I and all of us here have been in regular contact with other school districts that have brought back small groups, Torrance, Manhattan Beach, et cetera, and with great success. And we've been fortunate that we've been a little bit slower, and we're able to learn from their process and are informed by it. But certainly a logical question that I can appreciate, but know that if we do choose to bring people in, and we do get there, that we will follow the cohort guidance. And all of our school sites have now been visited by representatives from the Department of Public Health, and all of our plans have been analyzed, and all have been deemed so that our schools are safe and ready to open.
Okay. There's a question here regarding the President of the United States' goal to bring students across the nation within 100 days. How will that impact our plan for distance learning until the 21-22 school year begins? Is there any impact on that?
I would like to address that, and anybody else can add on. what happens at the national level or even the state level is not as important from a public health perspective as what is happening at the local level. And so that has been oftentimes what's happening in LA County, because of the current case rate, is more restrictive than other counties, even to our south in Orange County. And as Dr. Jansen mentioned, certainly all of the beach community districts have been open for some time and are expanding their opening. So we don't follow arbitrary timelines. We look at all the data that exists about not only the county, but what the case rate here is in Lawndale, and we try to be interactive with our staff and our parents about, what concerns they may have through surveys and town halls like this, where we can get a sense of what your concerns are.
Okay. Next question, how will the special ed parents or parents of special ed students access training tips, and will it be mandatory or voluntary?
Once the Department of Special Ed has that those videos available, they will make an outreach through teachers to the parents that these videos are available. They will be strongly encouraged, and we think they are great teaching tools for parents, but they are definitely will be voluntary, but especially if their child is having a specific behavior issue, we are encouraging them to go to the video so they can learn how to assist with their child at home.
We have a couple more asking the same question regarding summer school in terms of what it would look like if it will take place on campus. I guess if we can repeat the answer to that question, that would be helpful.
Are they saying summer school or ESY?
Sorry, summer school. What will summer school look like, and will summer take place on campus? So I'm assuming.
So ESY, we said that would be a kind of a hybrid or an option for parents to be on in person or distance learning. When we talk about summer school for our general education students, we'll be meeting very soon with the LTA Executive Board and to gather some ideas that what might be encouraging or incentivize teachers to work with their students in summer school, maybe a 2 to 3 week program in which you take 10 of your students. It could be distance learning, most likely distance learning, just to make it easy for us to be flexible. But you take 10 of your students and say, take 2 weeks to work on reading comprehension, or might be skills that we need extra support and building for students to mitigate learning loss. But we're still in the works for summer school because we know we're concerned, there's student fatigue, there's teacher fatigue. So we're trying to design something that's inviting for both teachers and students, and a short-term intensive learning, but most likely it'll be through distance learning, just regular summer school.
There's some concern out there that the vaccinations won't be ready until or before that March 8th return date for our students. I know it's a March 1st date. Is there any, what's the rationale or will there be in-person instruction if the vaccinations aren't provided?
I think we're still weighing that. I certainly, as I said, with a similar question, I understand the logic behind that question. Absolutely, that's undeniable. We're hopeful that the vaccinations will begin soon for educators. We're hearing dates of around mid-February, but of course that can change quickly, as can everything in our world of COVID. But certainly appreciate and understand the question. And as I shared in my briefing, I saw a question about partnering with other districts. We are partnering with other districts to work with the Beach Cities Health District, which is located right over on Prospect in Torrance. And we're hopeful that that will be a facility for our district, along with a couple other partners that we're working with. So we'll keep you certainly updated with that information as soon as possible and let you know.
I think this is a good general question. Is hybrid going to be LESD's kind of future from now on, or what will school look like? I guess it's kind of a general question.
Yeah, that's a great question. Don't have the crystal ball to know what all it entails, but I will say, looking into the fall and as time goes on, even students get vaccinated once at some point, teachers, whatever the situation may be. I think because of the COVID, we still have to maintain 6 feet distancing, wearing masks, and following all the safety and health protocols to prevent the transmission of the virus. So I think the small cohorts, hybrid, we have the systems for the classroom for teachers to audibilize their voices. And so I think all those things will have to be considered for school in the near future, maybe in the next couple of years until health, county health or the health situation around this virus is mitigated.
Okay. I guess they're talking a lot about the, I have a question here. So with or without a vaccine, we're looking at March 8th. Will there be a priority or some assistance from the district in terms of responsibility for the cost of vaccinations? Does anyone know specifically as to how vaccinations, is it a cost? Go ahead.
There's no cost. They're free. I drove my dad through Laco the other day and they just gave it to him. So yeah, no cost.
And another question out there, is there a possibility of extending the school year? What's that look like? Is that a consideration? Just looking for information, it says.
Maybe Dr. Santos, you could talk about how that would have to be negotiable.
Yes, definitely. I guess I should answer my own question or answer this question. Yeah, as of right now, there is a calendar. Someone did ask if there was a calendar for next year that was ratified by each of the groups, and I believe it went to the last board, so that will be sent out, or actually the next board meeting, it will be sent out. What we do know is that if we needed to add to the school year, we would have to come back to the table and negotiate that. And so that's definitely something that's out there. Someone did share in the that Kaiser is offering vaccinations for everyone 75 years and older. So that's for Kaiser members. Next question, in terms of returning to the class, go ahead.
I just want to, February 11th is the next board meeting, and I believe that the calendar has been taken to the board for that board meeting. So it would not be able to be sent out until the 12th. Thank you.
This is a good question regarding the return to the classrooms. Are the students' desks going to have dividers or any terms of protectors to protect them? And very similar to supermarkets, banks, things of that nature?
Yeah, I have seen districts that have invested in that, and we studied quite a bit on that. And what the research shows is that plexiglass in circumstances like schools is really not effective. The virus is airborne and can go up and over easily those plexiglass barriers. And in addition, they provide a false sense of security. People might think they can get closer to a child because there is plexiglass. Plexiglass is really only intended for circumstances like a bank, like a front office, like a grocery store where there's required close contact. In our classrooms, we'll really focus mostly on maintaining that 6-foot distance. And plexiglass, again, just provides a false sense of security, not to mention a lot of cleaning after that. So the recommendation will just be to ensure that we maintain 6-foot distancing.
Okay. A couple of questions regarding the vaccination. Does the district have any control as to who gets vaccinated? Is there an ability for us to encourage those that are in the SDC or special education population to go first?
Yeah.
We do not have control over that. We don't get to decide who gets vaccinated in what order. That's up to the Department of Public Health. And then it's further up to individuals to use the available systems to sign up for a vaccination. As Dr. Jansen mentioned, she was able to sign up her father. Those who are 65 and older currently are eligible as our healthcare employees. And as soon as the education sector opens up, the last time we talked with Susan Chidas, in charge of nursing services at Laco, the last time she was on, she was not on today, she shared that there would not be any differentiation between different categories of employees within the education sector. And that when the vaccines become available and an individual signs up online or over the phone for a vaccine, you would need to show proof of employment, which could be a badge and or a pay stub with your name on it and a driver's license or identification to show that you are the person that signed up. And also bring either a printout or preferably a printout, or if you have an electronic confirmation of your appointment, you can show it on your phone.
Okay. This is a question regarding COVID testing. Will there be weekly COVID testing provided for the SDC cohorts?
So the cohorting guidance does not require weekly testing. It requires surveillance testing, and we're working with another partner, Valencia Branch Labs, to have tests that can be conducted right on our sites. But the cohorting guidance with these small numbers, as Mr. Collier mentioned, 6 or 7 students and 2 or 3 adults, does not require daily or weekly testing. And we'll just be conducting surveillance testing.
Okay. What about the upper grade class size hybrid model? Is there such thing? Is that something that we would be, any information on that?
Well, at this time, the model is to have 14 students in a class if you can maintain the 6 feet distancing in the classroom setting. In the fall, there are some guidelines that may say you can do more, but what I believe, not any of our classes are large enough to do more than the 14.
Okay. Just a good follow-up question regarding surveillance testing. What is that?
It's testing a certain sample of employees every few weeks. I believe it's around 25% of the employees every 2 weeks, biweekly. And it changes as we adjust in tiers and or bring back more students.
Okay. Will parents be given an option for full distance learning, whether it's this year or next year? I'm assuming it's next year this person is asking.
Yes, as I mentioned before, we plan to put out a survey, and the option will be distance learning for parents. Excuse me.
A question regarding additional safety measures in the classroom, plexiglass, additional PPE. Is that a consideration?
I think we talked about plexiglass at length, and all the other PPE that's going to be made available to staff, and all of the safety measures are really listed in detail in our Safe, Clean, Ready plan. So I would recommend anyone go to our website, read the plan in detail, and then follow up with your supervisor if you have additional questions.
Well, just some general questions regarding just, did I hear correctly that an extended school year was mentioned? That's come up a couple of different times. Anyone want to?
Extended school year, if something were to happen, it would have to be negotiated with our labor partners. But it's something we could consider theoretically, and that we could utilize some of the funding, such as the learning loss mitigation funding, to support that.
Yeah, there's a couple questions out there, and I'm trying to select the top one here. It's if an employee were to get COVID, are they to use their own sick days? At this moment, I can answer that question. Unfortunately, yes, there is no longer an HR 6201 at this time. And so we're in the process, I know for LFCE negotiations and LTA, we have not discussed it. All leaves that we have are currently in our CBA, or our collective bargaining agreements, or the union contract.
Dr. Santos, I see a question about IPC. I wonder if Mr. Collier could answer that question, if
Sure.
the IPC will now focus on planning for next school year or current distance learning. I don't know if you can answer that.
Sure, I can answer it. Yeah, IPC will resume on Monday, February 22nd, and the focus will be getting prepared for the fall.
Okay. How do we ensure that our special ed students who require hands-on interaction are not able to maintain 6 feet distance? Is there any information that we can share regarding that? What safety measures have been put in place or going to be put in place?
Well, I will say in terms of the specifics, I'm not the expert on that, but we have done training for classified on behavior. There are protocols and training in place to handle a student when they are having a tough time putting on a mask or whatever the behavior may be. And during the first week of March 1st, leading before a whole week of time will be provided for staff to do training and do kind of dry runs of different scenarios so that staff is prepared, parents are informed, and have an orientation on how to handle the various scenarios.
Okay. There's another question here regarding parent choice for virtual or hybrid, how that would affect the dual immersion program. I mean, there's a lot of unknowns, but I think it also, since we're doing distant learning model, well, let's answer that one. How will the parent choice affect dual immersion, if it will?
No, I mean, students will have a place to be educated. So whatever program they choose, hybrid or distance learning, will ensure that they'll get proper instruction from their teacher. Just wanted to go back to the SDC training and so forth. Also wanted to add that if there are closer proximity for students or IAs, we also offer full PPE.
Can you follow up on the PPE? Maybe Dr. Jansen can join you. Is the PPE provided? Is it medical grade? Is it what specific?
Yeah, I would really recommend that people review the plan. There's specific categories of staff members that will get specific types of PPE. So I would really recommend people review that. And then if they have follow-up questions, reach out to your supervisor and have those questions answered.
I think this is a fair question here, to answer, and considering all the variables, for what school could look like next year and moving forward, do we anticipate changes, whether an increase or decrease to the amount of certificated and classified staff positions, or increases or decreases in the amount of hours of classified employees? You want to take the first shot at that, and then I can answer?
I'm sorry, Dr. Santos, I missed the beginning of what you said. You're going to answer it?
Yeah, no, I can answer some of that, or you could go ahead and I'll chime in. I think right now we don't know. I think that's the safe question. We know that we're not sure what school is going to look like. We don't know what staffing looks like. We don't have students here. I know we were held harmless this year. I don't know if that's going to be the case moving forward. Dr. Jansen, can you maybe elaborate? Is that what you heard?
Yeah, I mean, I think the biggest, most important answer is just that right now we don't know what school is going to look like in the fall. And so we're trying to design that. One thing we know is that school will always look different moving forward. And from my perspective, I think it'll always be that, we can take something positive from this terrible experience, that our students have had access to 21st century learning skills. All of our students have devices, and I think that school will always look different. And hopefully, things start to improve and we have more and more students come back. But at this time, we just can't answer that question. We just don't really have a strong feel for what school will look like. We'd all like to go back to normal, but it will never be the same. And so our best foot forward is just thinking about how this can actually improve instruction for our students moving forward and really prepare them for a new world.
Yeah,
Go ahead, please.
I add that there's questions about testing. So And Dr. Jansen mentioned that we are developing a partnership with Valencia Labs. Every week before the meeting with Dr. Ferrer, I meet with 12 superintendents in the South Bay from Inglewood, Lenox, Hawthorne, Lawndale, Torrance, and all the beach city districts. And what we know is that the test is only as good as the day that you took the test. If I get tested today, which is a Thursday, and I don't get the results for 4 days, and I have COVID, then I could be exposing others to it. So there was a question about surveillance testing, and maybe Dr. Jansen, you could, I think some people are joining late and missed some information, but the different types of testing, we would not be required to do it frequently, certainly not daily. If we had daily testing and everyone could test themselves before they come to work or school, that would be great, but we don't have that. So it's not a great tool to prevent COVID. It's a good tool to identify who has COVID, have them not come to school or work, and inform everyone with whom they've had contact. Could you explain surveillance testing again, Dr. Jansen?
Sure. Yeah, I understand. There's so much information, but yeah, surveillance testing is just when you have a sample of the population get tested, and they're not immediate test results. You don't get the results for about 2 days. So it's just a sample of the population that's tested biweekly usually, and that cadence could increase if we again saw a surge in LA County, for example, or the Department of Public Health changed the regulations. So surveillance testing again is just taking a sample of the population and testing them. So as Dr. Hamilton shared, though, surveillance testing may also provide a false sense of security. If I went and took my test on Monday and didn't get my results until Wednesday, and my results said I was negative, I could have contracted it on Tuesday. And I may very well be positive and walking around with something that says I'm negative on a Wednesday. So while it provides some reassurance, it really is also a false sense of security. Wearing our masks and maintaining distance are the two most important things for us to continue doing.
All right, another question. Will teachers be able to return and teach from their classroom this school year?
Yeah, we certainly hope so. This is something that the four of us talk about just about daily. As a former teacher myself, I know I do a better job teaching from my classroom, and we want to be able to get people back. But right now, where we are in the purple tier, the written guidance for us says to have as many people work from home as possible. And we really want to adhere to that. But know that I was going to say we look at this weekly, but we probably look at it daily. And we want to be able to get people back on site as much as you want to get back on site. But we're just trying to keep everyone safe.
There was a question regarding, and I can answer this one, can we make a safe, clean, ready competency exam staff has to take prior to starting back on campus? Would love to have the peace of mind that people actually read it. Well, we have that daily email that you received from me at 6:30 in the morning asking specific. I know someone did ask, do people review that? Yes, we do review that. And if you're found not complying to that, you're putting other people's lives at danger, and it will not be tolerated. So I'm just, as nicely as I could say it, it's not going to be tolerated. Are students being SDC or students in SDC cohorts or in other cohorts included in the surveillance testing?
They would be, according to what the protocols tell us.
Okay.
There have been a couple of questions. We're getting a lot of questions, and we will have a document with all of these questions so that if we didn't answer every single question, there's quite a few repeats. So I don't know if some people logged on late, but there were a couple of questions about discipline of students for not wearing masks. I would say that teachers should be handling that type of situation in a calm, rational way of just saying, when you're in school, you need to wear your mask and remind them to put it on. I know that I've seen, this is happening in many other districts. All of the beach school districts are open. Students are wearing masks. They've adapted to it very well, and I'm not too concerned about that. Actually, our problem is not with children, it's with adults. All of the known cases of COVID we've had, none have come from our campuses. Every person who's reported having COVID, it has not been traced to our campuses. Our campuses are safe, they are clean and ready. The Department of Public Health has deemed them so. And we just want to make sure that people who cough or sneeze or have any symptoms, like on the daily screening form, do not come into work. And it's not a chance you can take. Like I said, unless you have a daily test, you won't really know if you have COVID. But the reason that the CDC and other entities are allowing students to come back to school is because the science shows that students are very much less likely to transmit COVID because they tend to be asymptomatic even if they are carriers. Adults, it's different.
Okay. I think, again, another question came up. State testing, waivers, is that a possibility?
Get down on your knees and pray.
Well, I would say just quickly, February 10th was supposed to be when the State Board of Education was going to address talking to the federal government about waivers, but they have canceled that state board meeting in anticipation that there is going to be some guidance coming out from the federal government around testing. So, like Betsy says, pray and we'll wait our new federal government leadership.
Okay. Yeah, now we're just looking over. There's a lot of repeat questions here. Actually, there was one from a parent asking that if they would have options in sending their children, if they have students in LESD, to a small cohort as well, or how does that work? I don't know if they meant now or in a couple, next year.
What we have permission to do at this time with being in the purple tier is, and please chime in, Dr. Jansen or Mr. Collier, is what are called high need students, small groups of high need students. And we have been planning for some time to bring in SDC cohorts. First, we've had for a long time, I think starting October 26th, we brought in preschool students. They're scheduled to come back on March 1st also. Is that correct, Mr. Collier? March 1st for state preschool? March
1st, yes.
Yeah. There was a question here regarding, is there a concern about losing students to other districts? In general, that's always a concern. I'm not going to share that it's not, but go ahead, Dr. Hamilton, I saw you.
Oh, no, please share whatever you like. I can add if there's anything.
No, that's definitely a concern. However, we make decisions based on what we are able to do and how we're able to control what we can control.
I can share with you that I have received concerns from parents who have specifically raised why are our neighboring districts able to open and we are not. As I mentioned, we were poised to send in the TK2 application. I had just met with parent groups. We did not have letters of support from our labor partners. And the last group that I had to meet with to complete the application was the parent group. And I met with the parent group, and only one of the parents in that parent group felt that it was appropriate to return at that time until the case rate went down. And of course, that's what the county is waiting for. I'm sorry, my lights are going out in here. There we go. Yeah, but did I answer the question? I'm not sure. I got distracted by the lights going out.
I think,
no.
It was a question about whether or not we were worried about families going to other districts. And I think that's why we're also staying really connected with our community. Dr. Hamilton sends out regular messages. We have a parent town hall following this one today to really reassure parents that we're going to continue to focus on providing really high quality distance learning and focus our attention on planning for next year so that we can provide a really high quality program. So everything we can do to, every employee is important. Every food services employee, every instructional aide, every teacher, when you have an interaction with families, make sure they know how much we care about them and we care about their kids and the great opportunities that they have in Lawndale. Each of us is a salesperson for our district. So anything you can do to reassure families that they're making the right choice by staying in Lawndale, that would be great.
Yeah. One question was that other local districts are surveying employees, regarding vaccinations and informing them how to sign up. Will Lawndale be doing this when it becomes available?
We will communicate every bit of information we have. I mean, sometimes we heard some things this morning that we're not 100% sure of. I'd like to have, there were some questions that superintendents have. There are about 80 superintendents in the county on this weekly call. And then of course the 12 with whom I meet prior to that meeting. So I think we don't want to share information that's a maybe. We want to get solid information. So when it was reported today by Dr. Ferrer that she hopes to have more information to share with us next week, a week from today. And if we, whatever we have, I try to send a communication out every Monday. If it's time sensitive, meaning if I find out at 9:03 a.m. on next Thursday that it's open, I will send an email out to the entire staff with a link to how to do it. Because unfortunately, one of the inequities in our society is access to the tools necessary to sign up for vaccines, because the easiest way to sign up is to go online and continue to refresh your page until you can get in and schedule a vaccination. So it's much harder if you have to use a phone. So fortunately, our parents, students, and most of our staff either have a computer, district issued computer, or have access to one to do that.
I guess go ahead.
As soon as we have any information, we'll share it.
Yeah, a lot of the questions are repeat questions. I know that we do have negotiations occurring at this moment. So there are some questions that would be answered after negotiations. So I don't want to go into details about those. So I apologize for those that are specific to negotiations. Sorry, everybody. There's a lot of plexiglass questions, which we do encourage for you to read the Safe Clean plan. I'm just reading these as I go.
I'm going to say something about the plexiglass, because there was also a question about if people bought their own, would it be reimbursed? I do not recommend that. I think there are some things that early on in the pandemic, because some of us are reading about COVID 24/7, that were thought to be protective. And one way that plexiglass or a face shield is protective is when there are large enough droplets to go in the air directly out from your face. And if I were standing 2 feet away from you at a counter to exchange a paper document or something, and I coughed and there were plexiglass in front of me, that would provide some protection. Would provide protection from droplets big enough to be expelled from my mouth and possibly contact another individual. And that is why we do have plexiglass in front offices, just in the front office of the district and every school site. But we don't have evidence that it would be, not only do we not have, from what I've read, evidence that it would be helpful or productive within a classroom, actually for the HVAC systems, all of which are either been upgraded or will be, it's better to have the HVAC system circulate the air the way it's intended to do without impediments. So we can try to find more info, or maybe I can ask Dr. Jansen to give me a couple of links besides the Safe Clean Ready plan, but if there's anything specific that Dr. Urrutia might have on plexiglass, I could include that in a notification.
You bring up a really good point that a lot of what we saw happen early on in the pandemic tended to change, or the thought around it, the science around it changed. And Dr. Ruti and I did just read an article that shared that it actually impedes airflow in a classroom, and that it's much safer not to have big walls of plexiglass around, so that the air can be properly circulated into our new HVAC units. And on those HVAC units, we're really pleased to say that by the end of this summer, we'll have new units in all of our permanent buildings, and we'll have air purifiers for any rooms that didn't get a new unit.
A question comes up quite often in terms of the special day class reopening. Is there any idea, or is there any delay to that, or are we still planning as usual? At this time, I'm going to share that at this time, we do expect to have our staff back on campus on March 1st, and then we will have students back on March 8th. Will vaccinations be mandatory? I know, Dr. Gretchen, you went to a workshop just hours, or actually minutes ago.
You just called me Dr. Gretchen, Dr. Santos. Okay.
I did. I apologize, Dr. Jansen.
Yeah, we're still learning a lot about that. They talked about it in our call with Dr. Ferrer today. And then I also attended a new legal updates webinar just before we got on today. So there's a lot for us to learn about that. And we'll have to get back to you on that.
I noticed, Dr. Santos, there are quite a few things about social emotional learning, and I think that I just want to commend the Student Support Services Department for the planning that has been done and the work with our social workers. It sounds like there might be some frustration by a couple of people who put things in the chat. I would suggest speaking with there are the district PD, and then there could be opportunities at your site, or I would even say utilize your asynchronous time to provide support for your students. And if you need materials, to ask your principal or assistant principal or your social worker if it's something that they specifically use. But yeah, that's what I would suggest for now.
There's been questions in here regarding layoffs, reduction in forces. Just so you get it from our perspective, we've done everything we can to keep our all of our employees. It's not our intent to ever release anybody. So just so that is something that if you want specifics, you can speak with your labor president, whether it's Carl Williams or Denise. With Denise Bolton, and I've tried to keep them up. At this time, we are doing our best to maintain. Other questions? Let's see, scenarios. Do we have any scenarios? To be honest, right now, the district reviews every scenario. I know Ed Services is working on multiple plans on what could happen. I know that Dr. Jansen has multiple plans in her department as to feedings and cleaning and cleanliness. So there are multiple plans out there and scenarios. Unfortunately, we hear every Thursday as to how those are affected from the county public health. Trying to see.
There was a question in there somewhere, and I can't find it now. I keep scrolling through. I'm sorry, I'm looking for it now. I can't find it.
While you're doing that, someone asks, will there be support from, to staff that are struggling socially, emotionally themselves? Yes, you should be receiving weekly from Angie Berlin from our Department in Human Resources information. We have ease information. Every so often, I try to send out multiple emails about personal wellness. Those, the ease programs are available to all employees, regardless if you have insurance or not. Those that do have insurance, I know you can call your providers and they can assist you in providing you something specific. Those that do not, we can actually get in contact with your school social worker and they can provide you some resources at low to no cost.
One question that's interesting is if hybrid is our future, because we can't, one of the unknown factors is that there are these additional variants, and some of these variants, one article I read about a gentleman from Texas who had COVID, he developed more than one variant was found in his system during the time he was hospitalized. So this is a virus that does morph, that does transform and mutate. And so that's another reason why we have to, even if we've been vaccinated, we have to continue wearing masks because we don't know the science yet on, these are emergency authorization used vaccines, and we don't know exactly how, certainly they protect us, but we don't know with variants to what extent they would protect us. But this question was, if hybrid is our future, will the district be purchasing more Chromebooks for the school so that students have one at home and one at school? And I don't know if that's been considered. I know that Dr. Jansen worked with our IT director, Todd Barker, to deploy surplus Chromebooks, those that we can no longer support with, as we do with all of our students. But that they are being distributed to parents. And Dr. Jansen, I don't know if you have any information about that.
Yeah, I think it's a really great question and one that we're still exploring along with the Ed Services Department to talk about what instruction looks like next year. We do have one-to-one programs in our 6th, 7th, and 8th grade classrooms that have been established, and those kids just have one device that they take with them home, and then they use it at school as well. So there could be thoughts about that maybe being different for a TK or a kindergarten student. But I think those are conversations that we'll have with the Ed Services team and talk about what we could do there. But yeah, I think that's a great question.
Okay. It was just brought to my attention that Ed Services or Educational Services has ordered over 2,400 new Chromebooks this year. So they're definitely looking at that and providing options for our parents. I'm seeing questions regarding special education and how will we prepare our students to be in class, and what measures are taken to train them?
Well, I mean, a lot of that goes back to the training that classified staff have received, what the teachers have received, what they will be receiving the week prior to students coming onto campus, and how to redirect and encourage students to wear masks. So that will, many of that will be in the training and has already started. So I don't know if that person had missed that, but there's extensive training that's already been done and will be done leading into that week, and we'll continue to train. And we learn day by day how to handle this virus, and we learn from our surrounding districts and colleagues. And so all those things that we are learning will definitely support our staff and students and parents.
Just a quick question, were students' families provided an option for distance or in person, or that's the question? Yeah, no, the SDC students who are coming back, we asked those parents twice to what would they prefer. We had one round, and we came back with a second round, and these are people who are made choices to want to be on site. I'm just seeing more questions. Chromebooks have limitations when it comes to Zoom. Will we be upgrading to more capable devices? I think that's a question that we're doing our best with what funds we have to create, to be purchased. I know there's a backlog, I hear, not from us, but across the country with people buying tons of Chromebooks. But I think we have a good 2,400 of them just coming in. Yeah, I think Chromebooks are the object or the device of choice for most districts. It's affordable, and Google has done a lot to support K through 12 instruction. So I know we get updated versions of Chromebooks,
but I think, I'm not sure how I know our K and 1 students are using iPads, but I think Chromebooks are the preferred choice.
If I can just place a question was given regarding programs to help support our students with student engagement, things of that nature, and not the engagement from class, but more the social emotional. I just want to reinforce out there that our RAP programs are open and available. Even, yes, they're online. However, we have found that they have been successful. They do provide for the students sessions, fun sessions, but also a lot of conversational to work with their social emotional. So I can't encourage that enough. If you have questions, contact your principal and they'll connect you to the RAP program. I believe it's free. So the program is free and it's available after hours. No other questions that we haven't touched on? Any final words out there for the group? Should I start with Mr. Collier?
Sure. I know there's a lot of concern around SDC. Many of you know Sharon Asman, Dr. Jackie Mancia. They're very passionate and detailed, and they will do everything possible to provide services for you and training and continue to work with you. I know there was also concerns about PD and social emotional learning and needing more of it. It is definitely a challenge to balance this learning that we're going through, because we do understand there's less instruction in this distance learning versus brick and mortar when we have all the kids in front of us. And so we do have instructional demands to try to get the kids to stay at grade level. But at the same time, we do know the social emotional, kind of ills of all the things that are going on in society. So we just need to have continued discussion with our ed services, the principals, teachers, to say specifically what do we need to provide better or differently to make sure we meet the needs of our students.
I think
Dr. Jansen or Dr. Hamilton?
Yeah, thank you. I think just in closing, one of the big reasons for having this town hall was to reassure staff that for the majority of our kids, we're going to remain in distance learning for this year, and hope that is able to provide some sense of ease for everyone who's been scrambling to do distance learning, at the same time trying to think about what might happen if I go back into my classroom next week. So I'm hopeful that is a helpful decision. It's not a decision that any local districts have made, and we really stuck our neck out there and made the decision on behalf of our staff and on behalf of our students, because now it means that we can really focus on one form of instruction for our students at this time. So I'm hopeful that that's been helpful, and that our staff feels supported in that. And I mentioned earlier in a remark that school will always look different for us now, and I think that we can see that as a positive thing. And I think we all look forward to being in education at a time when some revolutionary changes might take place, and we can really see some gains for our students. So I'm encouraged and hopeful, despite the fact that we're living through a really challenging time right now. And I just want to express appreciation for everyone and how hard you're working. So thank you.
Dr. Hamilton?
I'll echo that. We appreciate very much everything you're doing. We know many of us are working around the clock, 7 days a week, and we are trying our best to support you and trying to balance the needs of our students, the very important needs of our students. That's why we're here, with the needs of our staff and our parent community. And we are a little bit of a lone ranger on this remaining in distance learning. I only know of, I believe it's Burbank, Beverly Hills, LA Unified, and San Bernardino City are the only districts in the greater Los Angeles area that I know are remaining in distance learning for the vast majority of their students. But as far as I know, the needs of our highest needs students continue to be met, even if the majority of students remaining in distance learning, and that is, as it's been mentioned, an equity model. And I've said many times, evidence and equity. If you want resources, we have to find evidence of need for the allocation of those resources. And that would lead me to, if Dr. Jansen, if you don't have time now to give even the briefest report on our finances, everybody's welcome to come to a board meeting twice a month. And if you don't want to come, but you want to listen to the reports on the budget, you can certainly request a recording of the board meetings. But maybe Dr. Jansen can give you a 1-minute summary of our financial situation.
All right, well, we'll try 1 minute. So we did. You may have seen publicized that the governor did put out his January budget proposal, and that's his proposal for the coming year, so 21-22. In the proposal, the Legislative Analyst's Office is finding that the state of California is actually doing okay. And I think that we thought the pandemic would really result in a significant economic downturn, but the state of California is actually doing okay. So while we don't see that we'll get a lot of new money, we certainly don't anticipate that we will see the cuts that we might have thought we would see going into the pandemic. But as a reminder, this is just the governor's proposal. We won't actually find out how much money we have for the 21-22 school year until about the end of June in 2021. So right now it's just a proposal, and the reason why it's largely a proposal is because most of our school funding comes through personal income tax revenue. So we don't find out how much the state will actually get until we all submit our taxes on April 15th. So around June is when we find out how much money we'll have, but it's not as bleak as we thought it may be. And while certainly some of California's lowest income earners are struggling right now because of California's tax structure, it's grounded largely in how our top 1% of wage earners are doing. And that group, as we often see, continues to get richer. And because of our progressive tax structure, school districts hopefully will benefit from that. But that's just a very preliminary look, and there's a lot more analysis for us to do, particularly as it relates to declining enrollment, which we knew was happening, pandemic or not.
I do have one more thing, and I'm sorry, but I see a question about equity curriculum, where we do have, cabinet in our spare time. We meet about 3 times as much as we've ever met before, but we have been working on an equity and action plan, and there is a committee of a group of people who are working with West Ed, REL, Research Education Laboratories, on and their project is called Equity in Action, as is ours. Shortly after George Floyd was killed, I sent a letter out to the community, and I got a lot of responses back, and I began to compile the names of all the individuals who expressed an interest in working on that, and also compiled resources. And this is what, as I say, we're doing, in addition to the other things that we're doing. This work with West Ed hopefully will provide somewhat of a blueprint for how we can approach equity issues. And there are 5 columns or 5 pillars of areas that we've been looking at, including human resources, curriculum and library resources, student support services, parent engagement, and so on. And so perhaps at a future town hall or in a report from me, I can share more about where we are with that. And someone did ask about the African American Parent Advisory Committee or Council. And yes, that's continuing, and Mr. Collier's heading up that work. And there are also programs at 3 schools with Trajectory of Hope, and with On Track to Greatness, and then at FDR with the Trajectory of Hope. So we've been looking at all those programs and how we can support our African American students and families more effectively.
Okay. I guess in summary, everybody, I'd like to thank you for your time. I know there's a lot of specific questions that we did not answer. We answered them in large groups. There were well over 100 questions, and we'll hope to get you responses to all of them. More importantly, things are changing every single day. As mentioned, every single minute. What we hear today changes in an hour. I'd like to thank all of those that are just everywhere. Everybody's involvement. I can't point out, yes, teachers specifically for your work with students, instructional assistants for your work with the students to help them, the food services for providing the food, the custodians for keeping our maintenance and operation as well, for keeping our places clean. Everybody across the board, those that are translating, to those in the front office answering the phones, to the school clerks, to the attendance clerks, to the social workers, to the interns, to our office staff across the place, whether it be in payroll to keep everybody paid. It's difficult. And I wish I can tell you that I'm going to give you an answer that you're going to like. But unfortunately, though, we make the best choices with the most information that we have, and we will continue to do our best to support our district. And as we shared, we are a lone wolf in our decisions that we're making, but we are equitable, and we will continue to do our best for you and for our students, and in particular, our community. So thank you for your time today.
Thank you.
Thank you.
Take care of yourselves.